So then I was juggling two different things that Chad and I were doing. And then we were also building relationships with healthcare organizations like home health and hospice. I call those our power partners because we work really well in the ecosystem of care together. So our CEO said, do you want to branch off and just develop a whole new department?
Yeah.
Or do you want to stay in research and development? I thought, no, let's do that. There's no blueprint to follow.
That's the entrepreneur in you.
How exciting.
Welcome to another episode of We Are Amada, and I'm very excited about this episode. I wouldn't say more than the others, but yes, more than the others. I am here with Heidi Maddocks, who is the Vice President of National Strategies. I said that wrong.
Healthcare strategies.
Healthcare strategies. But there's so much that Heidi does here at Amada Senior Care, and her history with Amada is, it goes back to like the very, very beginning. So I won't be able to do it justice. So Heidi, can you talk about how did you come to be involved in the senior care world?
Yeah. So hi, everyone. I'm Heidi. So the senior care world. So I started in the senior care world back in 2003. Yeah. So a long time ago in my other previous life. And my husband and I opened a home care agency in El Paso, Texas.
It's weird that 2003 is a long time ago.
It was a long time ago. It's crazy.
It feels like yesterday.
Yes.
Yeah.
Yeah.
Okay. So you start a home care company in El Paso?
In El Paso, Texas. We were living in St. Louis.
I didn't know that.
My husband was a Marine Corps officer, but he left the military, went out to the corporate world, realized that corporate world is much different than military lifestyle. It was like fitting a round pin in a square hole.
Square hole, yeah.
And so he said, enough of this corporate stuff. Let's see what we can do. We looked at other opportunities to be an entrepreneur. And the home care world seemed the best fit for us. Yeah.
And it was, you owned a...
I owned, can I say it's a competitor?
Yeah, of course.
Okay,
yeah.
So I owned a Comfort Keepers.
Comfort Keepers. That's
very different.
That's awesome.
Very different than Amada.
Very different from Amada, but Comfort Keepers. And you had it from 2003 till...
Until 2008.
2008, okay.
Yeah. And then we was in El Paso, Texas. When I got to El Paso, I was never there before in my life. Yeah. So it was very different. The people are amazing there. Absolutely amazing people. But it was, nobody wanted to claim El Paso. It's the farthest, I'm serious. It's the farthest west you can get in Texas. And it's 10 hours from LA and 10 hours from Dallas.
Did you know that I just moved my parents out of Del Rio, Texas?
No, I didn't know that.
My mom says the same thing. She goes, I love the people. But when my dad was teaching at a university there, and when they moved and my mom drove into town, she started crying.
Aww.
Because she said it's just such an ugly little town, on the border. But she came to love the place. But they just moved to North Carolina.
Okay.
In Cary, North Carolina. So, okay, El Paso, you're there. And
I'm there, and we were Rookie of the Year. We grew really, really fast.
Wow.
We obtained the VA contract. There's Fort Bliss that's there, the Army base. And so most of our caregivers came from the base, which was great. They like flexibility. And so what we did, and I always tell people, this is the perfect complement, is a home care business and medical alert buttons.
Oh, interesting.
Yeah, Amada has their own medical alert buttons as well. We'll talk about that later. But, I always kept them with me when I went to a home, did an assessment, build the plan of care, and would say, okay, when your caregiver's not here, what to give you peace of mind. Have a button.
Yeah.
So I had a button business and paired it with the home care, and worked lovely. So when we sold in 2008 due to divorce, I came back out to California and brought my button business with me.
No way.
And that was in 2006.
Okay.
And then in 2007, I ran into Tafa and Chad. They just started Amada Senior Care in 2007.
Yep.
And I said,
for those of you who may not know, Tafa and Chad are the founders of Amada Senior Care, who came together in 2007, 2008 to start Amada. You met them in 2007.
In 2007. They were in Costa Mesa. And
that's the original office.
The original
Not
office.
Even El Toro.
No.
Wow, no way.
Well, and so we go back a long way. Yeah. So I just walked in and said, hey, for all your amazing customers, for that peace of mind, they should have a button. So they would send me all their referrals. So that's how I built my business. But it wasn't just with Amada. I did that with all the other home care agencies as well. Tafa thought it was just him. Right. How do you think I could? So, that was in 2007. And then in 2016, I sold that business. Somebody found me on LinkedIn.
Mm-hmm.
But I had to consult with them for a couple of years. And I ran into Tafa, and he's like, hey, we just started franchising in 2012. Amazing opportunity. We're growing like crazy. I would love to have you part of the team. And so I said, okay. Well, I first thought about it because I'm like, I don't know. I'm an entrepreneur. I don't know if I could do that. But then I thought about it. I'm like, you know what? I think Tafa and Chad are amazing. And I love their core values. I just know they're good people. They have good character. And so I thought if I was going to work for anybody, I would love to be part of their team. So when I called Tafa and I said, hey, I'm interested, he's like, well, Stella just took that position.
Oh, no way.
But we have another position opening up in operations.
Yeah.
So
what year is this?
This was in 2018.
This is 2018. Mm-hmm. Wow, 2018. So I can't believe I didn't know all that.
Okay.
But here's... I kind of tell this story a lot, but I can't remember if I don't know if this was 2020 or 19. I don't know when it was.
Okay.
But I was talking to one of our biggest franchise partners, Ken Jensen, and I was asking him about, hey, how are things going? He'd been in business since 2012. He was always number one, number two. And he said, who the most valuable person in your whole entire company is? And I thought, he's going to say me. Is it me? I was like, who's he going to say? I don't know if he was going to say me, but I was like, who is he going to? And he went, Heidi. Aww. Heidi she is amazing. Whenever I call her, and as we talked about, she's owned a home care company. She built a big home care company. She knows what it's like. I mean, so it meant so much to me. And so that's awesome.
Yes.
But now, okay. So there's been an evolution because you start in 2018, but the department you're heading doesn't really get created until 2023. Mm-hmm. So, but okay, so let's talk about. Well, I don't know where you want to go with that because there's so much I want to know about. Because so from 2018 to 2023, you're doing what?
Well, in 2018, I started managing the operations department. Mm-hmm. And then from there, I grew into helping with recruiting and retention. Yeah. Because we were growing, right? So you had to wear a couple different types of hats, but so understand how to help out your colleague. So started recruiting and retention. And then we started looking at talking to our COO, we have to start managing these vendors because a lot of different vendors, different partners wanted to do business with Amada. Mm-hmm. They were hearing about us, and they're like, I want to get in and working with them. Yeah. So we developed the research and development department. Yeah. So I started that department.
And what I think is interesting because so many people don't realize in a franchise that you have sometimes we talk about the fact that Amada is so a lot of franchises out there are franchise organizations that just happen to do home care.
Right.
Like they are really franchise organizations. They just happen to be in roofing. They happen to be in painting, right? Mm-hmm. I always felt Amada is a home care company that just happens to be franchising. Like we are a home care company, right? Mm-hmm. And what then starts happening is that home care company then becomes bigger and bigger with more and more people around the country, and then you have all these vendors. And that becomes a big part of what we have to do is not only manage those relationships, but keep finding the best vendors at the best pricing for all franchise partners, which is something I guess that if you're an independent out there and you have your own company, you don't benefit from that.
Right.
Because you just get whatever vendor you get and it's the pricing that you get. I mean, you could probably still do well as independent, but so you start managing the vendors.
Research and development of the vendors. And we want to protect our franchise partners. So we don't want just anyone calling our franchise partners and soliciting to them. Yeah. Now, we prohibit solicitation. Yeah. So we make it very clear. But we look at them as partners of ours. We want to work with them. We respect them. But we definitely are looking out for the best interests of our franchise partners, getting the best price. We have a relationship with them. So if something goes wrong, we can step in and help with that. And just really establish those connections for the franchise partners. Yeah. So that was very much needed.
And it's a lot.
It's a lot.
You hope and it's not perfect. Like you speak to anybody in the franchise industry, there's always the mistake, right? Of the vendor you thought was going to be amazing and they're not. Mm-hmm. And then you have to go in and switch it out. And then you have the vendors that have been with you forever, right? That are just amazing. And they make your organization look great, right? Because as a franchisee, it's part of what you're paying for.
Exactly.
A lot of what you're paying for is that you have somebody like us in Orange County, California, that's thinking about this, right? That's thinking ahead of what vendors should be there. Now, you're still involved in that, but then you evolved from that. Yeah. The department is still there.
The department's
Michael
still there.
Is still
Michael's
there.
doing amazing.
Yep.
It's grown a lot. But what happened, and when I was managing the research and development department, one of the co-founders, Chad, and I were working together, developing CEUs. So that's a whole nother, and I have a love for CEUs. And that's
what is that?
It's continuing education units.
Yes.
So we develop CEUs directed for case managers and discharge planners, as well as some social workers and RNs. But the whole concept behind that was we developed these CEUs. It's complimentary for the audience. So you would go, for our franchise partner, you're bringing something to value to the hospital or to the skilled nursing facility that, hey, we have this great education for you. Rather than just bringing donut drops, you're bringing something of value, and they love it. So
and all case managers, social workers, the nurses, they all have mandated continuing education hours they must do every year.
Yes.
Or they lose their license.
Exactly.
Right? Like they have to do it.
Yes.
So it's amazing, and I think it's really cool that what you guys developed is you teach the CUs, and they get credits, right?
Yep.
That's exactly what they need. And what I love is the topics that you guys choose. Yeah. Like, so what are some of the topics that you guys have?
So again, we directed for case managers and discharge planners, right?
And why those
because
folks?
they're great referral sources, especially think about, and that's a whole nother topic, about readmission prevention.
Right.
So when someone gets discharged, we want to make sure that they remain safe at home and don't get readmitted.
Yes.
Because if they are readmitted for the same cause they were discharged for within a 30-day period, those hospitals and even home health and other organizations get penalized from CMS, which
Millions,
is government.
Right?
Well, up to 3% penalty, which really can be a lot of money.
Yeah. So what Heidi, this is so important, guys. If you're listening to this, realize this is really what's happening in the healthcare system right now, right?
Yes,
what makes us so important, and the CUs that Heidi and her team create, it's unbelievably critical because these hospitals, these skilled nursings, and the staff there, they're under a lot of pressure. They're basically being told, hey, if your patients aren't dying, get them out.
Yes, they are.
They cannot be in the hospital anymore because it's a fortune. Yeah. Every minute you're in the hospital is a fortune.
Yes.
But they're being told that not only you have to kick them out with love,
but
make sure they don't come back. And that's what you're talking about.
Exactly.
If they come back, then what happens?
Well, then the hospital gets penalized, and it's a lot of money. Up to 3% is a lot of money. It's very, very important. And like you said, when you're being admitted to the hospital, they're thinking of how to get you out. Sicker and sicker, they're releasing. That's because they get a lot of pressure from CMS. And then they also want to keep the Center for Medicare and Medicaid Services. So
and they really who are they?
They're the biggest payer. Their government dollars for people that are taking Medicaid, with their Medicare beneficiaries and Medicaid beneficiaries. We call those Medi-Medis.
The Medi-Medis.
The Medi-Medis.
That's the big shots. Yeah.
Yes. So anyway, so we want to make sure that we're capturing those that are being discharged. They're going home. So you want to be friends with your case managers and social workers.
Yes.
So that's why we developed them with them first in mind. But we do have social workers and RNs that also attend as well because they're very, very educational.
Yeah.
So you asked me some of the topics.
Yeah. I love it.
Gosh, we have. So the latest one we just did was long-term care insurance policy holders, like having them understand what's in their policies and training the case managers on that. We have a great one on readmission prevention.
Of course.
Of course. That's our hot topic.
Yeah.
We have a really great one on a guide to VA benefits, which is my love because veterans are I just advocate them and train our franchise partners on how to take care of them. And there's so many other we have about 12 topics right now, but we're always developing one or two a year. And so we'll do a national CEU. And then what we do is we develop these CEU kits and we'll give them to the franchise partners and say, okay, now you can provide it on a local level.
Yeah. So our franchise partners go in, talk to the case managers at the hospital, and they are able to offer these courses live right there. And what I think it's so cool because the reason and this is kind of nerdy of me, but the reason I think this is so cool is that you're satisfying the need for continuing education credits.
Yes.
They need it anyway.
Yes.
So why would they not? We're not charging a dime for them to participate, and we bring lunch sometimes,
We
right?
bring lunch and learns.
Bring lunch and learns.
Yes.
And the topic allows us to take that time that they must listen to explain to them how valuable our services are.
Exactly.
Right? Like
exactly.
with no other agenda than to educate them, and then their light bulb goes off going, whoa, the VA benefits would actually pay for some of this care. And if I work with Amada, or wait, long-term care insurance would actually pay for these services and make sure this person is readmitted. Yes, right. So it's brilliant.
It is.
It's
and
brilliant.
that reminds me, one of our big CEUs that we love is the 4 funding sources. That's part of your elevator speech when you're talking to referral sources, is explaining that we help find options to fund the care.
Yeah.
So it's not just if they can't, it's private pay, they can't do all private pay. Well, do you have a long-term care insurance policy? That is love. Are you a veteran? Do you own a home? Like do you have life insurance? So there's different ways to pay for care.
Yeah.
And we want to be top of mind for these referral sources that we are going to help find the funding.
So somebody one time asked me, they said, well, that's ridiculous. Why? Obviously, the hospital, when they're discharging Mr. Patel, they certainly are sitting down with Mr. Patel and going, do you have a long-term care insurance policy? Do you have a VA policy? And explaining to them all the ways that they can receive the care and even helping them do that. And what I usually say is, not really, right? I mean,
exactly.
And that's why the education is there. Like I think our franchise partners, when they first start, they're surprised at how little the hospital staff knows
exactly
about all these programs that are available.
And so we position ourselves as that we're long-term care insurance experts and VA advocates. So we want to be we don't want to have that. We don't want the case manager to have a conversation even at a discharge for that. We want as soon as they're admitted.
Yeah.
So the admissions director at these hospitals are key, because as soon as somebody is admitted, the case manager will ask, like, do you have a long-term care insurance policy? But they don't know what to do after that.
That's right.
Or you a veteran? You are. They don't know what to do after that. So they don't need to know. All they need to know is to call you, Amada.
That's right.
And that we will take care of the rest.
Yeah, we got it.
We got it. Because you want to make it as easy as possible for those. They have a heavy load, and we want to take that off of them, and we will take care of it for them.
Well, here's what's so cool about this. I love it when you have a strategy, you deploy the strategy, and it really pays off. So you started the department in 2023. We're now in 26? Is it 26?
Oh, 26. So what happened? No, that was, yeah. So what happened was we were doing CEUs and research and the research development.
Oh,
vendors.
Right. How you transitioned.
So then I was juggling 2 different things that Chad and I were doing. And then we were also building relationships with healthcare organizations like home health and hospice. I call those our power partners, because we work really well in the ecosystem of care together. So our CEO said, do you want to branch off and just develop a whole new department?
Yeah.
Or do you want to stay in research and development? I thought, no, let's do that. Like, there's no blueprint to follow.
That's the entrepreneur in you.
How exciting. And that was one thing I was going to tell you. 2 things. One is I love what I do. Because when I was a little concerned about being an employee, I thought about it and I thought, you know what? I can take my entrepreneur skills and help entrepreneurs.
Yeah.
And I know what it's like to be, and that's such a deep love for me. And then plus helping these seniors about finding ways to fund for care and explaining to them what home care is and what home health is and what the difference is, and educating them. It's just, you are making it's purposeful. It's so rewarding, because everybody wins when, you can help a senior in need.
Yeah.
Yeah.
So you start going toward helping and guiding some of these payer sources and actually targeting these payer sources. And I think it's really cool is that I think the percentages. I don't know. So we used to do traditionally, how much of our business was VA business before you kind of started
Chad and I took
all this?
over?
Yeah.
So my department took over VA. It was in June of 2023.
Okay.
Yeah. And at that time,
I
don't remember how many franchise partners we had, but we had 16 had VA contracts.
Okay.
We are so hyper-focused on aid and attendance, a pension for helping veterans, but nobody was really focused on the other component of VA. And the reason why was because back in the day, the reimbursement rate wasn't very good, the hours weren't very good, and the VA was managing all the contracts, all the care for the veteran, and paying you as the provider.
Right.
And it was a mess.
Yeah.
So they, in 2018, they outsourced their everything, all their contracting and all their payer to TPAs, third-party administrators, Tri-Western Optum, depending on what region.
Yeah.
So all the VA had to do now was manage the care
Oh,
for the
interesting.
veteran.
Yeah.
So the reimbursement rates started increasing dramatically, and that longer hours they were offering these veterans. So Chad and I took over at the right time. So we rolled up our sleeves, did a deep dive and understanding and educating, and then we just started getting everyone contracted.
Yeah, and I think didn't we go from 3% of our business was
It was 3%,
VA.
and now it's just shy of 15%.
15% of our national revenues now come from the Veterans Administration in a lot of different ways, but from the Veterans Administration. That's a huge amount. That is crazy. From 3% to 15% is amazing.
And I just ran the numbers this morning. I don't know the exact numbers about how many veterans at the moment that in 2025 we served that are still active, and it's almost 2,500. It was 2,497.
Wow.
That's just a lot of veterans to make a difference.
Yes.
And what a lot of people don't know is that these, especially senior veterans, when they just left the military back in the day, if you were not service connected, which means if you didn't have an injury or disability that you got from active duty, they basically just said, have a good life.
We know so many people like that, right? Mm-hmm. They served maybe, now it's so funny to say that now it's Desert Storm, but it used to be World War II, Korea, but even now, Desert Storm. You leave the military and then you go into private life. You get jobs. And you forget all about it, right? You don't even go to the VA anymore. Isn't it a crazy number of U.S. veterans are not even registered with? What's that number?
Yeah.
It's a crazy amount.
So right now we have about 18 million veterans in the U.S. and there's 8 million of them are 65 and older. It's probably a little bit more now because that was from last year's data because they're getting older, right?
Yeah.
And they're living longer. And then a little over 6 million have a service-connected disability rating. Wow. There's a lot that goes into that. So when you're mentioning, and every year we get together with the Department of Veterans Affairs, and we met with them in July, and they shared their 3 pain points, and they need the help. That's why they're doing a lot of community engagement. Their 3 pain points is suicide. That's the number one.
So sad.
It is so sad. And then homelessness, although I'm happy to announce that they are making a dent in homelessness for veterans.
No way.
And so it's decreasing for veterans.
Wow.
It's increasing for civilians.
Wow.
Mm-hmm. And then their 3rd pain point is getting veterans enrolled in VA healthcare. There's tons of benefits out there for the veterans, and a lot of the senior veterans are not enrolled in VA healthcare. 48% of veterans are not enrolled.
That number is insane.
It's insane.
And I heard that what you're finding is sometimes they're not because they think if they do, they won't get their Medicare benefits.
Exactly.
Or they just don't even know about it, right? They don't even know to ask.
Yeah, so VA healthcare is a benefit, not health insurance. And that's where a lot of people are confused. So you get VA benefits. It doesn't mean you're going to give up your wife's Blue Shield insurance.
Right. You've earned it. It's yours.
So it is a benefit. So they don't understand. You keep your private pay if you still private insurance if you want, or you can go to TRICARE, which is a VA insurance. But VA benefits, healthcare is just a benefit.
Yeah.
So you may go to your private doctor and for hearing aids, you need hearing aids, but instead of paying it through your insurance, you can get that for free. If you go to the VA, if you're enrolled in VA healthcare.
And veterans just don't know that.
They just don't know that. They don't know it. And so we have a lot of educating we need to do in our community. And the VA is reaching out to providers, to different in the community, saying,
they
can you
want
please
our help?
They realize that they changed their tune.
Yeah.
And they want us to educate the community's veterans, families that they do truly care. They're putting a lot of great things in place. And they need our help to spread the word. And that's what we're doing. We are chipping away at it. We are getting there. We're making a difference. If we all can do that in our community, that's exactly what we're designed to do.
I think it's so cool because this is, you and I know this, but it's being involved in a business where the more money you make in it, the more service you're providing.
Yes.
And it's not just, I don't mean to disparage other, like, roofing is amazing. Putting in a roof of somebody's house, and high-fiving them when the roof is over, that's amazing, right? Like, there's a lot of amazing industries. But the fact that 14% of our revenues come from taking care of one of our veterans, right?
Almost 15%.
Almost 15%. Like, that is just it. And knowing that, for sure, what's crazy is knowing that is reducing suicide rates.
Mm-hmm.
It's increasing mental health and your happiness, right? When you have somebody there with you,
yes,
ensuring that you're not alone, your meals and your companionship, like so many things that are unbelievably connected to just mental health, right? Is that we're providing that we are able to give that to so many veterans. Like, what an amazing way to make money.
It is. And it's like I tell the franchise partners when I talk to them, when I train them about how to educate the veterans and the families and the healthcare professionals about the various benefits that they have to offer. And then I hear the stories, how we're impacting those veterans. I have tears in my eyes almost every day, but it's good. It's a feel good, and we are making a difference. And these veterans, when they meet the caregivers, or even our franchise partners, they just it's like family to them.
Yeah.
And it's truly it's an amazing feeling. So I tell our franchise partners, when you're out in the community, you're not selling, you're serving. You're serving the community.
Like that.
And because some people could be, if they have an operations background but they don't have a sales background, we'll help them. Our sales department, our training support does that. But if you put the serving hat on, you can feel confident that you're doing good. You have a purpose, right? You don't feel like you're coming across salesy.
Yeah. Well, and also I think so somebody may be thinking, okay, so if I start an Amada Senior Care business, 14% of my revenue is going to be VA. Maybe not, right? Because there's 4 or 5 major payers that Heidi and her team are working on chipping away at. Mm-hmm. We do so much long-term care insurance. Yes. We're doing more and more Medicaid, which I thought was interesting.
So right now we do 4% of the revenue, of revenue collected.
Total revenue
is 4% at Medicaid. We don't want to be top-heavy on government dollars, but we want to make sure that we have different revenue lines available for our franchise partners that we can support them. The average is close to 10% for an agency to have Medicaid. So we're not even, so we're going to we're definitely helping increase that payer line as well. And then we are doing, 2026 is the year of thriving for workers' comp as well. So we're
That's
working.
Another one. I think in Michigan, our partners they're doing auto insurance.
Yeah, they're doing auto insurance for workers' comp.
But you're saying general workers' comp. That is a big play.
It's a big play. So we just did a national conference we attended in Nashville in November. We always knew we've done workers' comp, but we're growing so fast we didn't really focus so much on it. But we also we were increasing, looking at what other payer lines that our franchise partners can have. So we identified 18 solid managed care organizations to work with. So what they do is, one, we just signed a contract actually today for an organization, a large MCO that they're national. We always look for national partners. Okay. And their top, for example, FedEx, Disney, they are those clients. Wow. So the MCOs, managed care organizations, they manage the care of the injured worker. Sure. So people like Home Depot, they'll have those MCOs manage that care. And so we are there to help make sure that those injured workers get healed and recover at home.
We might have to call ourselves Amada Care.
Amada Care, whether Amada Senior Care, Amada Care. Or not.
Yeah. Here's what I wanted to just call out on that is that, so you look at Robert Christensen, our very first franchise partner, in the state of Oregon, I think. Mm-hmm. He does a ridiculous amount of Medicaid.
He does.
We do none here in Orange County.
No.
None. And that's what I mean is what I love about what Heidi's been able to do with Chad and with her team is be able to take where you are in the country and find the methods that you can go after. It's okay if in your state, in your county, if Medicaid is not fantastic because VA might. If VA may not be because the VA locally is just not up to speed or whatever it is. So then you can focus on long-term care insurance or cash. So, and my message is that it's cool that we don't have in home care a really powerful payer like Medicaid, who's just able to come and say, here's what you're going to do, here's what you're going to charge, here's what you have to accept, right?
Right.
And that's what's so cool is Heidi's team is able to help you in your area be able to figure out what is your mix.
Exactly.
And it's fine,
We're having
whatever that mix is.
Very meaningful conversations with our franchise partners. Like, let's look at your territory and we'll find like the best. Or I'll always have long-term care insurance, number one.
Right, that's everywhere.
Yeah.
Cash long-term care insurance, done.
Yes,
doesn't matter
done.
where you are.
Yes.
From Alaska to friggin' Florida.
But
you're doing it.
It's great to diversify your payer lines.
Yeah.
So we're looking at more. And so it's a very exciting year for our department. We're growing rapidly to be able to help our franchise partners find what those lines would be to help grow their business.
I love it. We actually have so much to talk about still, but I know that you have an appointment coming.
I do.
So we'll let you go.
Okay.
Thank you. Thank you for this. That's awesome. What you've done for our franchise partners is amazing.
It's a
really
love
is.
of mine. I absolutely love what I do. It's so rewarding to be able to make the difference in people's lives, not just the franchise partners, but just knowing that it owes a domino effect to the caregivers, their office staff, and all the people that we're serving. It's definitely just a rewarding experience. So, yeah.
Well, I told you this would be a treat. And I was excited to do this interview. So, Heidi, thank you so much.
You're
Appreciate
welcome.
it. And please continue watching the episodes of We Are Amada. We thank you so much for your time.